Welcome to the third episode of 5P Podcast, the first international regenerative medicine and anti-aging podcast that will give you the tools to age with the greatest health, wellness, and appearance. It is directed by Professor Dr. Jaime Rodriguez Quintosa and Professor Dr. Debbie Binsky. We are your hosts, Professor Carlos Galante and Sandra Sola.
We are at the headquarters of JRIS Productions, Wave Smith Studios, the podcast accelerator that walks you through the steps to create a successful podcast from scratch. We invite you to subscribe to our YouTube channel at 5P Podcast to learn more about this topic. And with us, we have the 5P Podcast Ambassador, Professor Dr. Debbie Binsky, the Queen of Anti-Aging Medicine and President of World Council for Preventive, Regenerative, and Anti-Aging Medicine, WOCPM. Welcome, Professor.
Thank you, Professor Carlos, Sandra, and Professor Jaime Rodriguez as Ambassador of 5P Podcast. I think today is a very special day. You see, I'm wearing black, which is, I never wear black, but today is very special. We pay tribute to Professor Caffinson, and we have the Madame today. She's extraordinary, not usual lady, but very special lady in the world. Today, we have the pleasure of having Professor Dr. Svetlana Trofimova. She's a medical doctor, doctor of medical science, professor, specialist in ophthalmology. She's deputy director for scientific and clinical work at the St. Petersburg Institute of Bioregulation and Gerontology. General director of the Tree of Life, very famous predictive medicine clinic at the St. Petersburg, Russia, which is my family also patient of Professor Svetlana. Institute of Bioregulation and Gerontology in Russia is also, we know the director is late Professor Vladimir Caffinson. And Professor Svetlana also president of the Russian Society for Anti-Aging Medicine since 2012 and vice president of the European Society for Preventive, Regenerative, and Anti-Aging Medicine SM since 2019. And this is very important. This beautiful professor is the General Secretary of the World Council of Preventive, Regenerative, and Anti-Aging Medicine, WOCPM in Paris, since 2016. As you see, she has an outstanding curriculum and even more experience in regenerative and anti-aging medicine. In addition, I'm sure Professor Dr. Trofimova has become such an example for many health and business professionals, and we are sure that you are also an inspirational icon for many women worldwide.
Thank you very much. Thank you very much, my dear President, Dr. Professor Debbie Binsky, for this introduction me, and thank you very much for invitation for your podcast. It is really very important for me, and I think it is very important for our community work.
Thank you. It's a pleasure. Professor Svetlana, we like to start the podcast with 5P Podcast with the same question to all our guests of honor. And this question is special because everybody has a different background. Why did you decide, Professor Svetlana, why did you decide to dedicate yourself to anti-aging medicine?
Yes, you are absolutely right. It's a very important question for each doctor, especially who works in anti-aging medicine. And to tell the truth, from childhood, I know that I will be a doctor. But when I studied, I decided that prevention way is more important than treatment. And you understand the comprehensive approach to health impossible without preventive medicine, impossible without preventive way. And that is why I decided to work at this field. And I want to help everybody to be young and healthy and live more longer with the health.
Thank you, Professor. So,
Thank you.
what criteria of aging can we use to estimate the aging process?
I think it is a really very important question because, as you know, there are many methods for assessment of aging process, but there are only two significantly markers for check our aging process. There are a level of melatonin and length telomeres, because there are two markers which shows our premature age. And if we decided that in the center of our brains there is a very important gland, pineal gland, which produces many substances, but among of them very important the melatonin. And unfortunately, with age, the level of melatonin decreases, and patient who has age-related diseases as heart problem, Alzheimer's disease, diabetes mellitus, have a low level of melatonin. And gerontologists decided to take this marker as one of the main markers for aging process. And of course, the length telomere. Everybody knows that with age, the length of telomere decreases. And this one is it possible to show our aging process is how our aging process different our passport date.
Okay, then what indicators can be used to assess a person's biological age?
Yes. Now, as a rule, we use. Of course, there are many possibilities to check of our aging process, but the two main markers there are the length of telomeres and the level of melatonin. And I know Professor Dr. Debbie Vinsky checked these markers in your clinic, and there are two markers. Is one of the important markers if you decided to check of biological age of your patients.
Yes, it's true.
And Professor, you have published a lot about peptides. Could you explain us what they are?
Sorry, what they
are? What peptides are? Yeah, I can repeat the question. You have published a lot about peptides. Could you explain to us what they are?
Yes. Peptides are short molecules. There are two groups of peptides. Extract from the different tissue and organs, their synthetic analysis. All of these peptides, all of Carvinson peptides are short peptides with a very low molecular weight, or if we say about, if we are talking about synthetic peptides, there are 2 or 3 or tetra amino acids. Peptide consists of not the more the tetra amino acids. And what is very important, that these peptides can regulate the gene activity and protein synthesis.
Oh, wow. And how do Carvinson's peptides differ from other peptides in the market?
First of all, the main difference it is we know the structure of these peptides, and we know how peptides regulate the gene activity, because there is a special sites binding sites in genes, and when the peptides binding sites of the promoter region of genes, the proteins begins synthesizes, and that is why the functional activity of this organ or tissue increases. It is a physiological regulation of the all function in our organism. Peptides regulate the gene activity, synthesis of proteins, and that is why increase in functional activity of all organs and tissue in our organism.
We remind you that we are interviewing Professor Dr. Svetlana Trofimova in this third episode of 5P podcast. She's a doctor of medical science, specialist in ophthalmology, president of the Russian Society for Anti-Aging Medicine, vice president of the European Society for Regenerative and Anti-Aging Medicine, and Secretary General of World Council for Preventive, Regenerative and Anti-Aging Medicine, WOCPM. So, Professor, in one of your presentations, you talked about Hans Selye's theory. Could you tell us what it is about?
It is one of the important theory for understanding an aging process, because under the stress, under the chronic stress, Professor Hans Selye understanding us what are the changes in our organism happens under the stress. Unfortunately, everybody under the stress, and these changes in our organism appeared in under the not only stress but only the chronic stress. And general adaptation syndrome by Selye consists of three stages. The first stage, anxiety stage. As a rule, under the stress, last maybe 1 day, maybe 2 days, the first changes appeared in our organism. First of all, there are some hormones, stress hormones. The level of stress hormones increases, and our main organs, immune and hormone organs, there are pineal gland and thymus, the function of these organs decreases, and that is why some of these problems, some of diseases can appear. But at the second stage, the stage of the second is resistance stage. As a rule, our organism can restore, but if it is not impossible, if in our organism cannot manage with this problem, the third stage, stage of exhaustion, and at these periods some of chronic disease can appear. And very important to influence on the second stage for improve of our main hormone and main immune system. And that is why it is very important to improve our possibility to stop of this chronic stress.
Okay, thank you. So the basis for the creation of Havinson's peptides was the theory of Hans Selye, which is a stress theory, as you just said, and we are all in chronic stress right now. How can peptides help us reduce the manifestation of stress?
Yes, you are right. Theory of Hans Selye formed the basis for peptide bioregulators. The first peptides were created 30 years ago in the Military Medical Academy. And these peptides, there are two groups of peptides, extract and synthetic peptides. Extract peptide from the different tissue and organs with a very low molecular weight, and their analog synthetic peptides were consist of 2 or 3 or 4 amino acids, and all of these peptides regulates of gene activity. And the main reason for creation of these peptides were to influence on the second stage of adaptation syndrome, on the second stage and the stage of resistance. And that is why, under the effect of this peptide, our organism can manage to these the changes in the immune and endocrine system, and that is why chronic diseases and some aging process doesn't development. It is very important for understanding the mechanism of action of peptide bioregulators. First of all, we can to stop of such changes were appeared under the chronic stress in our organism and aging process.
Thank you, Dr. Svetlana. And how about the patients? How them can benefit from the peptides? How they are administered? Does it need to be an injection?
I told you that there are two groups of peptides, extract and synthetic peptides. And among of these peptides, there are 3 kinds of medicine. Drug medicine, injectable peptides, food supplements with peptides, and cosmetic with peptides. And as a rule, the combination of all of these products with peptides. Why? Because, first of all, it is very important to check the health of our patients, to check the biological age of our patients. And according to the results of this investigation, we recommends for our patients not only injectable peptides, but and food supplements and cosmetic with peptide. And what is very important, that molecular peptides in the medicine, in the food supplements, and in the cosmetics absolutely the same. But the quality of this, quantity of these peptides, of course, differs. The maximum of peptides in the medicine, and of course, the minimum is cosmetic. Why we decided to produce cosmetic with peptides? Because we carried out many investigations which show that peptides very quickly penetrate through skin. And as you know, our skin has not only immune system, but and special hormone cells as cells of keratinocytes, which produces of extrapineal melatonin. And I would like to mention that with the age, not only the level of melatonin decreases, but and level of melatonin, extrapineal melatonin in our cells and our skin cells decreases too. And is the scientific work of Professor Dr. Debivinsky. She shows that under the pineal gland peptide, if we apply it for the skin, we can influence not only for such cells, but in the main gland, pineal gland, and that is why we decided to produce cosmetic with peptide 2.
Thank you very much, Professor Svetlana. That's amazing. My General Secretary, the very famous Professor Svetlana. Yes, I did my research and almost 2 years in St. Petersburg Institute in Russia, and the very good result, as we know, as Professor Svetlana explained, skin is the biggest organ in the body, and the result with this peptide bioregulator, when I do research, it's very amazing. And I remember about the skin, I also give, because my father had a stroke, the story I share also to the 5P. That time I remember I already do hormone therapy, I already do the stem cells, but when I give the peptide to my father and then later many other patients, the result is very good to the skin. And also I combine many different peptides, the injection and also the supplement, and the diabetic retinopathy in my father's eyes, it's getting better, and she can drive again, work back at the office. And I think this is amazing, not only theory but practical in the clinic. This is great. And we also check the length of the telomere. As we know, the telomere getting shorter. This is one of the biological measurement also measure, and after 6 months to 1 year is 2.5 times longer, the length of the telomere, 2.5 times. So this is we check before and after to the patient. So, Professor Svetlana, thank you very much to you and Professor Kavinston. And this combination is good. So I have a question for you. How do
Yes, thank
peptides
you.
affect the stem cells? Because after that is even getting better. My father even said he's getting younger than before he had a stroke. So this combination is really good. So can you explain how do peptides affect the stem cells?
Thank you very much, my dear President, for this very important question. Because to tell the truth, you explain everybody the mechanism of action of peptides. I remember your father, and I remember that your father had so difficult disease, and you are absolutely right. That decided to ask me about stem cell. As you know, everybody, that our each organ has own stem cells, and very important to push for differentiation of own stem cells, because only this one can to give restoration of the organ and tissue. And we carried out a special investigation. We took raw material on frog and add a different peptide for this tissue. And under the different peptide, different tissue appeared. For example, if we took retinal peptides, under the retinal peptides, retinal cells appeared among the stem cells. If we took brain peptide, the different cells, different tissue, brain cells appeared too. This can explain why after the treatment with peptide, our patients recover after so serious and so difficult diseases as a stroke or retinal congenital diseases. It is one very important information for understanding the mechanism of action of peptide.
Thank you, Professor Svetlana. So these peptides have good effects. So they affect very good for the stem cells in our body. And another question, but I think this is already answered. Yeah, is it possible to use peptide with stem cells? Yes, you already answered it's possible. Do you have additional
course,
explanation?
Of course, it is very important, and I think we have some not as a rich experience, but we have rich experience together. It is, and we receive very good results among the patient who got the stem cells with the peptides. As the peptides have inductional activity for stem cells, that is why this peptide helps to stem cell to differentiation, and that is why we can receive the positive result more quickly and more strong, more bright if without stem cells or without peptides.
And this
Thank you.
thank you,
Wonderful.
doctor. Yeah, this explanation brings me a question: that which peptides do you consider the most important for slowing the aging process?
Yes, I start talk about the adaptation syndrome, and I told the two main organs, pineal gland and thymus, with age, the functional activity of these organs decrease, and the same situation we check and with aging process. And that is why the main peptides for anti-aging medicine, of course, there are two peptides, pineal gland and thymus peptides. And I would like to tell you about our 15 years investigation, and two groups of our peptides the two groups of our patients for 15 years got peptides, pineal gland and thymus peptides. And then in 15 years we checked their health and their quality of life, and we received that peptides can prolongation of the quality of life, and what is very important, under the effect of peptides, the mortality rate decreases twice according to control group. And that is why peptide now is geroprotective medicine, and all of gerontology decided that only the peptide, Covinson peptide, can call geroprotective, because we have 15 years clinical investigation which shows that peptides can stop pathology process and prolongation and decreases of mortality of rate. Because, as you know, unfortunately, we cannot say about prolongation of life among the people, among the animals, of course. It was done 17 investigation among the different animals, and every time we got the same result, that peptide prolongation of lifespan among the animals.
Thank you, Professor. And as a specialist in ophthalmology, what peptides do you use for eye diseases?
Unfortunately, with age, our visual acuity decreases too. And first of all, of course, the reason of this one can be in retina, in lens, of course, but the main serious diseases, of course, depends on our retina. With age, the receptors in the retina, the level of receptors decreases, and that is why of some of dystrophic process development, and so difficult diseases as age-related macular degeneration, diabetes mellitus, or retinitis pigmentosa, now it is really very serious disease. And only after, under the effect of peptides, we can say that we can stop of this pathology process and improve visual acuity and visual function among patients who has so difficult diseases. And you asked me about the peptides. Of course, one of them, it is a retinal peptide. If we say about diseases, that is why we can say about only the medicine. Retinal, I mean, one of these peptides, but of course, the reason of retinal peptide impossible to be one, and it is many reason of this problem, and that is why we can to try to influence on all of mechanism of action of pathology of these diseases. And as a rule, we combination retinal peptide, vessels peptide, brain peptide, and after this, our patient continues treatment with food supplements with peptides, because I told you, unfortunately, it is really very serious diseases.
Thank you. So it seems that the potential of peptides is massive. Actually, they're like very new. Here in Spain, we're starting to talk about them, about these peptides recently. Do you export Havinson's peptides all around the world?
Of course, now we started produce our peptides in the Europe, in the Italy, and coming some peptide now. Is it possible to buy this peptide in Italy? And we received the permission, European permission for food supplements. But unfortunately, the medicine, injectable peptides, is it possible to receive possible to receive the treatment now only only in Russia now.
Okay, thank you very much. So this is the end of this third episode of 5P Podcast, the leading international podcast of regenerative and anti-aging medicine. Here, you will learn about the latest developments in this field and receive tips on how to slow aging and live a fulfilling life.
Thank you. Today, we interview Professor Dr. Svetlana Trofimova. She is a medical doctor, doctor of medical science, professor, specialist in ophthalmology, deputy director of scientific and clinical work at the St. Petersburg Institute and Bioregulation and Gerontology. She is general director of Tree of Life, Predictive Medicine Clinic, very famous clinic at the St. Petersburg and the world, I can say, Institute of Bioregulation and Gerontology, president of the Russian Society for Anti-Aging Medicine since 2012, and vice president of the European Society for Preventive, Regenerative Anti-Aging Medicine, and she is the General Secretary of the World Council for Preventive, Regenerative Anti-Aging Medicine, WOCPM, since 2016 in Paris. And as you see, she has an outstanding curriculum, more experience in regenerative anti-aging medicine. In addition, Professor Dr. Trofimova has become example for many health and business professionals in the world. And we are sure we all happy, and thank you very much for having you here, Professor Dr. Svetlana Trofimova from Russia. Thank you.
Thank you very much. Thank you very much, our President Davis. Thank you very much for everybody. It is really, I'm very happy that you invited me, and I'm happy that can to be together with you as a one team. Thank you very much, my dear President. Thank you.
Thank you.
You're
And
welcome.
thank you for listening and supporting this initiative. We invite you to subscribe to our YouTube channel at 5P Podcast. If you want to learn how to make a successful podcast, subscribe to at Wave Smith Studios on YouTube. See you next time, and remember, take care of yourself today to defy time tomorrow.